Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Besides political debates, few things generate as much hype, hysteria, and polarization as discussions about vaccination. The emotionally charged arguments often out resemble discussions, and one can hardly sift through the copious amounts of misinformation with this conflicting narrative. How can we find the truth? Mission Evolution Radio TV show is coming to you around the world on the Voice of Canada Broadcast Network, www.vocbn.ca. With us this hour to help weed through the confusion regarding vaccinations is Dr. Joe Warsh. Dr. Warsh is an integrative pediatrician, public health advocate, and author of Between a Shot and a Hard Place, the first truly balanced book on vaccines. He speaks internationally on children's health, chronic disease prevention, and the future of medicine. His website, theshotbook.com. Dr. Warsh, thank you so much for joining us on Mission Evolution.
Thank you so much for having me on.
This is a wonderful topic, and I'm so glad that you're coming from a balanced viewpoint, it looks like. So,
to.
Yeah, it's always a challenge. So, why did you specialize in pediatrics?
I always loved working with kids. You know, I was growing up, I grew up in Toronto, and I coached my brothers hockey and baseball and just loved it when I was doing that, and then started working at summer camps and working with kids. And when I went to med school, was always to be a pediatrician. I wanted to help kids and really get ahead of disease and prevent infection and disease. And so that's what really led me into pediatrics.
Well, that's a good place to start as well. They're still young enough to have an immune system, right?
Mm-hmm. Yeah, and they still listen to you in general, unlike the adults.
Exactly. A lollipop and you got their attention. So what's an integrative pediatrician?
To me, it means balancing the best of modern medicine with alternative or holistic practices. So I did all the regular training. I went to great medical school, great pediatrics program in Los Angeles, but I got a little frustrated with the regular system and the really short visits, medications for everything. And so that's what led me to start learning about integrative medicine. And I try to balance the best of both worlds. So it's not about really, poo-pooing anything in modern medicine. I think we have a lot of great medications. It's just really trying to bring in some of those alternative modalities and using both kind of complementary to each other.
One thing I've always wondered about is in our system, we go for the big guns right up front, and then when all else fails, then we look to alternatives. And it seems to me like we should start the other direction. Is that what you do? Is approach it from, okay, how can we treat this naturally, and barring that, then we bring out the big guns?
Absolutely. So, every situation is different, and sometimes you need the big guns right away. So, we're happy we have an emergency department if you break your leg or need an MRI, and sometimes you're really sick with a pneumonia and you need an antibiotic, but that's not the reality most of the time. Most of the time we have some time. It's not a very serious issue and we can use something more natural, or even more so, like you said, like preventing it. And that's the key. That's something that we've just absolutely forgotten about in modern medicine. We're so focused on treatment, and we need to spend as much time focusing on prevention and lifestyles and food and movement. And that just doesn't seem to be a huge part of the conversation over the last, 5-10 years.
Well, it used to be children, they were pretty doggone healthy. It's just as we got older that we started developing issues. Are you seeing now that that's changing, that children are not necessarily healthy from the get-go?
It's actually very concerning what's going on with kids. You look at the statistics, it's about 40 to 50% of kids with a chronic condition. And that's not the way that it used to be. Statistics used to be maybe 50 years ago around 5%. So the numbers are skyrocketing, and that's across the board with almost every single condition you look at, whether it's autoimmune conditions, autism, mental health concerns, cancer. You're seeing spikes in all of these. Some of these conditions you really never saw in kids, like type 2 diabetes. It was literally called adult onset diabetes, and now we're seeing it in kids all the time. So that is very concerning to me as a pediatrician, but also as a father, that we are seeing these disturbing trends, and until really this year, you didn't really hear a lot about it in the media or the news, and it has become a part of politics, which I think is good in a sense that it's being talked about. I don't think it's political in any way, but I think that it's good that we're at least talking about it now so we can do something about it.
What do you attribute it to, this huge spike in childhood illness?
I think the first thing to even talk about there is the fact that we don't really know, right? I think that is such a concern that we've seen this this decreasing health, this major concern, and we weren't focused on it. We didn't see the research focused on it. We're not talking about, well, all right, well, here are the 10 biggest things that are our concern. Here's what we're doing about it to kind of turn things around. We never really had that. I think it's our food and the toxins that we're exposed to. I think our kids eat a very high proportion of ultra processed foods that are devoid of nutrients. And I think that we're just exposed to so many chemicals at all times. And the mix of those two things really has led to an inflammation in our kids' bodies where they just can't handle it. And adults too. It's not just kids. I think we're just exposed to so many things. And at some point you just can't handle it anymore. And for each person, it's different. It depends on what your environment is, what you're exposed to, and what your genetics are. And that will express itself in different ways depending on your circumstances.
Well, there's no denying that in the last 50 years, our diets for children and for adults have changed drastically. We're under high stress. We don't have time to, people don't cook at home anymore. They've even changed the design of kitchens around, just the fast, throw it in the microwave kind of approach to food. And then, of course, there's what they feed the children at school, which is the leftovers the government has, to add to the school lunches, lots of dairy and this and that. But also, what about the hormones and stuff that are in our food and the trauma, say for instance, the adrenaline?
Yeah, I mean, I think it's all important. I think all of these things need to be studied. I think certainly when you're talking about animals and cows and the hormones that they're shot up with and the antibiotics that they're given and the medications that they're given, I think it all affect. I mean, how would it not affect us, right? It certainly does. I don't think we know exactly how everything affects us, but there's this cumulative dose, this increase in all of these toxins, especially when you're talking about America, where the rules are not very stringent, or certainly haven't been over the last decade. And you just see more and more chemicals, and very few of them have been studied. None of them have been studied with all the other chemicals. And so we have these companies that are like, oh, this product I made is safe. Of course it is. It's great. Let's put it in the food. And that's it. And then we kind of move forward, and there's 10,000, 20,000 chemicals in our food. And we just don't know what they're doing to us. And not all of them are bad, and certainly not all of them cause an issue. But I would think that just like anything, if you eating more and more of a chemical or more of a toxin, and that is affecting you, then the more of that you're exposed to, eventually it becomes a problem. Just like lead, right? I mean, you don't want any lead, but if you have a little bit of exposure, it's not a huge deal. If you get a lot of exposure, it could kill you, right? So it depends how much, but we're just getting a lot more of all of these chemicals. And I think that's a problem.
Another thing that kind of stands out that's different than 50 years ago is all the screen time that children are exposed to, and the Wi-Fi and the 5G and all of that stuff. You think that's playing a part as well?
I think there's no doubt that that's playing a part. I mean, I would separate those two things because I think those are big topics, but screen time is very important. I think that we are seeing a huge increase in screen time, especially in the older kids. Some studies have shown 7 to 9 hours on average of screen time a day for teens, which is insane. And it's not the screen, I think that's the issue per se. It's what we're not doing. So,
Exactly,
if you're, if you watch 5 minutes of a TV show, that's not going to fry your brain. I'm not so worried about that. A parent talks to me if their, toddler watches a cartoon because they need to go to the bathroom or they're in a car ride. Like, that's not what I'm worried about. I'm worried about the 7 to 9 hours where your kids are not outside, not moving, not socializing. So it's a double hit because you're in front of the screen, but you're also not moving and exercising. And our life is already so sedentary. I mean, we already have all these amazing technological advances like, cars, and we have escalators and all these things that can get you around, but you don't have to work anymore like we used to. And you go back 100, 200 years, like people were just moving a lot more, and our genetics haven't changed that much. We're meant to move, and we just aren't. So I think that's playing in. And the second part of your question, all the signals that are flying by us, the Wi-Fi, the EMFs, I don't think we know how that's affecting us. I mean, just common sense to me, the stronger these things get, the more of it that there is, and the more signals that we're exposed to, the worse it is for our health. I mean, we're made of chemicals. We're made of protons and neutrons, and all this stuff is affected by magnetism and electricity and forces. And how would it not affect us at some point? I don't know if we're at a point where it severely affects us, but maybe it does, or maybe it does for some people. But we just keep getting stronger and more. And I think it's something that we ought to look into, because I have a feeling in 50 years, we're going to look back and be like, oh my God, like, how did we not realize that all these things were affecting us? Like, we know that the moon affects the water, right? So why don't all these signals affect our body in some way, even just a little bit?
Yeah, well, we're electromagnetic beings. I mean,
Right.
it's just scrambling. So the other thing that comes to mind is, like you said, there's so much screen time and lack of activity. But isn't fresh air, sunshine, running around, getting exercise, isn't that a detoxer that might help
Yeah.
with all these chemicals and stuff that we're getting on board with the inferior food?
Of course, parents talk to me all the time about detoxing for kids, and there isn't really a lot of research around like, oh, you should take this supplement or that supplement, or you should do this. So it's hard to know exactly what to recommend, but we do know for sure, how do you get things out of your body? You pee, poop, and sweat, right? And so if you're not moving, then the chemicals and toxins are not moving around your body like they're supposed to be. The lymphatic system's not working like it's supposed to be. You're not sweating and getting things out through your sweat glands. I mean, that's very obvious. If you're not drinking enough and moving enough and pooping and peeing, then that stuff sits inside of you. And so just basic things, common sense being common, we have to focus on the very, very basics and the very, very, foundational aspects, which should not be controversial, like drinking more fluid, going to the bathroom more, getting more sunlight. Like these are basic things that we know can help you with your detoxification. And in a ever increasing world of toxins, this becomes more and more important.
So don't the lungs detox as well?
Yeah, of course. I mean, I
Yeah.
think your entire body detoxifies at all times. I mean, that's what our immune system is for. That's what our liver and our kidneys are for. But we're not helping those things. We're not helping our body to do what it's supposed to do when we're eating crappy food and we're not moving. It just makes those parts of our body have to work harder, and we're not giving it the tools that it needs to be successful. And I think that's why so many people are sick.
If the mother's diet, like most of our diets, is bad, doesn't that affect the child before it's even born?
Of course, everything that you do would affect your baby. I mean, again, we have some amazing systems, and we have an amazing immune system and detoxification systems, and you have the placenta, and all these things filter out a lot, but only to a point, and only so much. And so we know that you look at cord blood, and there are all sorts of chemicals in there. The Environmental Working Group has done studies on that. You see over 100 chemicals in cord blood. So yes, some of that goes through, and how it affects the baby. I don't think we know quite yet on every single chemical and toxin. We certainly know that some can affect the baby, but those are only the ones that have been studied, and most things haven't been studied at all, or certainly very minimally in human studies, because there aren't a lot of people lining up to do those studies and have their babies, unborn babies tested. But I just go back to just like basic precautionary principle. Like, it's logical that these things might affect our kids. We tell pregnant moms to avoid a lot of things,
Well,
right? So I
have
think
to leave.
chemicals is reasonable.
We're going to have to leave a cliffhanger a little bit here because it's time for us to take a station break. Dr. Warsh and I will be back very shortly. Don't go away. This is Mission Evolution, missionevolution.org. To vaccinate or not to vaccinate? With us this hour discussing the impact of vaccinations on children's health is Dr. Joel Warsh, the author of Between a Shot and a Hard Place. His website, theshotbook.com. Dr. Warsh, let's dig right in. Are infant and child vaccinations really necessary?
Well, yeah, I think it's a great question, but I think we have to go back a little bit to my position kind of generally on vaccines, which I think is really important to say. I'm not against vaccines. I think that we need to have discussions around vaccines. We need to have discussions around every medical topic. In my office, we have people that do all the vaccines. We have people that do a slower schedule. Some people choose not to. My personal belief is that we shouldn't force people to do things, but we should have discussions and give people the best evidence that we have to help them to make decisions that are best for their family. And so I don't tell people what to do. I think logically it would be very arrogant for me to say anything against like the CDC schedule or Public Health Canada. There are big groups of people that have studied these things for a long time and come up with their recommendations. And so as a physician, the only thing you can really recommend is the published schedule. But I do think that there are more and more questions. There are more and more parents that are hesitant. The more that you research into vaccines, the more questions you really have. And I think it's really important at this point that we don't call someone who has a question an anti-vaxxer, or it's just because you're hesitant that makes you woo-woo. I think that we are at a time where things have changed a lot in the last year. And I think that there was a lot of censorship. There's a lot less censorship now. And I think that's a good thing. And I think we should be open to having discussions about vaccines, not to stop vaccinating, but to make them as safe as possible. And I think we need to discuss risk versus benefits. And I don't think that should be controversial, but anytime you talk about anything about vaccines is super controversial. And that's unfortunate place where we are. But the reason why I wrote the book was not to tell people what to do. It was to have these discussions, to open up the discussion and to say, look, we need to talk about this. Parents have concerns, and we can't silence that, because that is not having a good effect. And that's not the way that medicine's supposed to be. We're not supposed to silence people. We're supposed to talk about these things.
So one of the things that I've heard and wondered myself is how much of the vaccination schedule is designed to serve the masses. In other words, make sure we eradicate this disease versus what's in the best interest of the individual child.
I don't think they study it in an individual level. It's a public health level. So, I mean, those things are not exclusive, right? I think that of course, to some degree, you're thinking about yourself and your own child. And of course, we don't want our kids to get sick with anything, but the schedule is a public health schedule. It's it's an America schedule, a Canada schedule, protection of the masses. And so, yes, it's not really studied at the individual level, because everybody's different and you have certain situations, and there are recommendations for what you should get in general. There are recommendations based on your specific genetics or certain conditions that you might have, or maybe you had a reaction to a vaccine. So this is where working with your doctor would be important, because everybody is different. But I don't think that in medicine in general, and especially when it comes to vaccines, there have been a lot of discussions about individualized medicine. And I think that is something that's really important for the future that we do talk about. Because again, it should not be controversial to talk about how do we make the safest vaccines for you? Like, what are your genetics? What are you susceptible to? What are you most likely to encounter? What supplements, herbs, detoxification products, whatever it is out there that can decrease your risk to have a side effect. How is that controversial? Like, why don't we study that too? Like, that would make people have more confidence to get them.
Yeah, and my next question, of course, is why is the vaccine conversation always so polarized?
It's just been for so long. I mean, I don't know. Medicine is just more like my way or the highway. It's almost become gospel. Like, vaccines are some sort of religious entity, or I don't know what it is. I think that there, certainly during the pandemic, anything that created hesitancy was censored. And I mean, we know that there were many people that talked about it. Like, even True Information was censored. Anything to get people to vaccinate was kind of the mentality. And I think that's a big long-term mistake. I think that we need honesty, and that is why I think so many people have lost faith in institutions, and they've lost faith in medicine in general. And we're seeing it. I mean, the big polling, like hundreds of thousands of people. You look at before the pandemic, it was like 70% plus of individuals thought positively of doctors and healthcare. And now it's like 40%. You have the highest rate of unvaccinated kids, the highest rate of not fully vaccinated kids, the highest rate of hesitancy you've ever had. And that's because people don't feel like doctors are listening. They feel like it's about money, and they feel like it's just about more and more and more, and no one's thinking about safety. And we have to have those discussions. We have to talk about it. We have to make people feel comfortable to do the things that are being recommended. And we have to be open to looking at everything and saying, look, maybe we can change some of our recommendations. Maybe we don't need this vaccine anymore. Maybe we could have fewer of these. Maybe this one's not working so well, so we should find a better alternative. Like, there are a lot of things that can be done besides pro-vaccine versus anti-vaccine and putting people in two camps. It doesn't make any sense. Just because you want a safer vaccine doesn't mean you're anti-vaccine. It just means you want a safer product. Like, that you're not anti-medicine because you want a safer medicine.
Well, when I was bringing up my small children, there was still the and I don't know where it stands now, but there was still you absolutely had to vaccinate your children completely with this program, or they didn't get to go to school. I mean, it was very, very strict, and there was only a health exemption or a religious exemption. And my doctor said, well, now they've removed the health exemption, and I can't make up something if it's not there. And I went, I feel the spirit a coming over me, okay? Because I felt that, when the disease poses more of a threat to the child than the vaccination, then I'm all for it, okay? So with that in mind, how does receiving vaccinations at a young age impact a child's immune system?
I mean, there are two schools of thought on that, right? And mainstream medicine would say that your body handles it very well, and it helps protect you against that infection and that disease for several months or a lifetime, depending on each vaccine and how well it works for you. So generally, the kind of way that it's discussed is like, it's safe, it's effective, it works. There's nothing to worry about. The risks of a side effect are really small. The concern that a lot of parents have, and a lot of individuals that have concerns around vaccines, they discuss, and I think it's realistic that we just don't have long-term research on all of this stuff. There really isn't studies on vaccinated versus unvaccinated kids, and I just don't think that we have a full understanding of how it impacts the immune system for each kid. I think that there are consequences that we just don't take into account because we just don't study it in that way, and that doesn't mean that you shouldn't get vaccines. I just think that these are reasonable questions that need to be asked, and the research is not so definitive when you look at it like we're told, like, oh, it's just there's no risk that it can affect your immune system, doesn't increase your risk of this, that, and the other. And there are great reputable studies that show that certain changes can decrease your risk of asthma, or decrease your risk of eczema, or decrease your risk of autoimmune conditions. And we certainly have a list of things that vaccines can affect. So I'm not sure why it couldn't do some of these other things too, at least in a small amount. And when you start to have more and more vaccines, which is what we're seeing, then there's a cumulative risk. And that's the other thing that's not talked about, is even if your risk is 1 in a million for any sort of shot from a bad reaction, but if you get 30 vaccines, 50 vaccines, 100 vaccines, as you add more vaccines, that risk adds up over the totality. You might have a 1 in 30,000 chance of having a severe reaction, or maybe it's even more than that. And that is an important discussion, because the goal is not to give kids more vaccines. The goal is to have kids that are healthier, right? And so we have to balance more vaccines with health. And we also have to, I think, keep in mind that just more isn't always better. It might be better, but it's not always better.
Like covering all your bases is overkill sometimes.
Yeah.
So
Yeah.
rather than vaccinations, are there studies on taking the approach of bolstering the child's immune system?
I mean, yes and no. So I would say there really aren't a lot of studies on vaccinated versus unvaccinated kids. There are a few, and generally those studies, they're just not the best research and studies, but mostly they show that the unvaccinated kids are doing better on a lot of these markers. But they also have a lot of other things that they're doing differently in general. So it's hard to kind of tease that out, but nothing is equivalent to getting a vaccine. A vaccine is very specific. A vaccine gives you protection from the disease, and I think it works quite well in general. You give yourself a measles shot, you have a very low risk to get measles ever again in your life. Like, it works 97% of the time. So that's pretty good. That's not the question to me. The question is, at what cost, right? The question is, if you do this and you are protected from measles, does that increase your risk to asthma, allergies, autism, whatever else? Like, that is the question that I think needs to be asked, so parents can really make that risk benefit analysis, because I feel like that risk of the vaccine, we just don't have a great picture or a great understanding of what the total risks are. Right now, it's kind of minimized when you ask that question, and it's like, oh no, it's fine, and the risk is very small. And I think the risk is less small than we think.
I wouldn't have to agree. And you mentioned something interesting. How has autism been linked with vaccinations?
Yeah, so of the controversy in vaccines, which there's plenty, autism would be at the top, right? And the mainstream research and the mainstream medicine would say, like, vaccines have nothing to do with autism. The science is settled. We've studied it thoroughly, and we absolutely know it's been debunked. And that's what I was taught, and that's what I said, because you don't go look at the research yourself. Like, why would you? People tell you that. Your respected professors tell you that. The CDC says that, and so you're like, okay, that makes sense. I guess it's been thoroughly studied. And the reality, when you look at the research, and when I went to look at the research for my book, I was shocked. I mean, really, there just isn't a lot of research on it. And that is very surprising. So there certainly is some research on it, but it's almost all on MMR or thimerosal, which is the mercury component of vaccines, which isn't even really in most of the vaccines anymore. So it's really just on MMR. And that doesn't answer the question of vaccines and autism. That's a vaccine. And most of those studies are, did you get MMR or no MMR in the setting of getting all the other vaccines and how that's related to autism? So the question hasn't really truly been studied, honestly, and it needs to be. We need vaccinated versus unvaccinated studies. We need to look at all the vaccines. We need to see if it's related or not. I don't know. I'm not saying that it is. I've seen kids that have autism that never had a vaccine before, so it's certainly not the only thing. But I don't think it's unreasonable when you have so many parents have the same thing. My kid was acting this way one day, got some vaccines, and was acting differently the next day. I think that is a reasonable thing when there are thousands and hundreds of thousands of parents saying the same thing, that we should take it seriously and we should not brush it off, and we should do more research and not just say it's settled, because I don't think it's settled. And I don't think if anyone looked at the research themselves, they would think it's totally settled.
Why do you think they kind of railroaded a lot of these vaccines without sufficient studies?
I don't know. I mean, I feel like there's a lot of a push when you look at the way that people talk about it to kind of say, well, vaccines don't cause autism because it's never been proved to cause autism. So they don't study it because then you can't find it, right? So you can say, well, it's never been proven to cause autism, which is true, right? When they had the vaccine omnibus, which was the big court cases in the early 2000s around vaccines and autism, they found that vaccines don't cause autism because it hasn't been proven to cause autism. But that's a very circular way of thinking. And that is what has been done. It's like, it hasn't been proven to cause it, so therefore it doesn't. But that doesn't mean that it doesn't. It just means it hasn't been studied. And you would have the same conclusions before you studied smoking and lung cancer, or glyphosate and cancer. Like these things are not studied until they are, and they're not proven until they are. And they keep saying that they don't have an association until they do. And again, I'm not saying that they do. We don't have the research, and we haven't done the studies to say one way or another. And I think that is such a huge travesty for our kids, because if there is some association there, we should have known this a long time ago, and we shouldn't have moved away from that, because there might be some ingredient or some part of it that is actually the big factor there, and we could change it. We could take it out. We could do something about it. Or maybe it'll have nothing to do with it after we do the really good research. And that's going to be the study. Those are going to be the studies that are going to give parents the confidence. Yeah, I want to go do these. Exactly. I'm not worried about it anymore. There's nothing anti-science about that. That is science. That is literally what it's for.
Well, we're going to have to take another station break. Dr. Warsh and I will be right back to continue our discussion. This is Mission Evolution, missionevolution.org. Should I really have my baby vaccinated? This is Mission Evolution, missionevolution.org. With us discussing the pros, cons, and pitfalls of vaccination is Dr. Joel Warsh. His website, theshotbook.com. Dr. Warsh, over the years, there's been a lot of talk about linking sudden infant death syndrome with vaccinations. Where do we stand on that one?
Modern medicine at this point the research seems to show that there isn't a great link between sudden infant death syndrome and vaccines. And I think that's a really interesting topic, because there were some studies, there were a few that maybe showed some causal link, but the issue with sudden infant death syndrome is we don't know what causes it, right? It's obviously supremely tragic, the most tragic thing. A baby dies and we don't have a reason for it, and you certainly want to blame something. It happens enough throughout the year. I mean, it's not very common, but it's common enough. And so when you are getting vaccines every couple of months, inevitably some kids are going to get a vaccine this morning and have a sudden infant death syndrome this afternoon, and it's going to have nothing to do with the vaccine. So that's what makes it really, really tough, because obviously if you get your vaccines this morning and your kid has a serious reaction and dies from whatever reason that afternoon, you're going to want to blame the vaccines. And the tough thing with sudden infant death syndrome, in my mind, when you look at the research, is number one, there are actually a bunch of really good studies that don't show a link. So that's the first part. But second thing is, the majority of the, I guess I would say, like, common sense concerns around vaccines are, we have an increasing amount of vaccines and an increasing amount of chronic disease, an increasing amount of autism. And so because of that increasing amount, there are associations and links that people draw. But sudden infant death syndrome has gone way down. over the last several decades, and really since the Back to Sleep campaign. And so you would think that if more vaccines were related to sudden infant death syndrome, then sudden infant death syndrome would go up and would have gone up over the last 20 years, but it's actually gone way down. And so to me, at least epidemiologically speaking, that speaks against vaccines being a major contributor to it. That doesn't mean that it couldn't ever contribute to it. I'm sure it does. I'm sure in certain situations you could have a reaction to anything. You could have a peanut and die, right? So some people have a certain immune system or a response where you could get something and have a serious reaction, but I would think that they're not as concerningly linked as some of the other things might potentially be. But sudden infant death syndrome is extraordinarily severe and a really important topic. And so even if there is a small portion that has to do with vaccines, we should continue to study it, and we shouldn't assume that has nothing to do with it, because maybe it has a percentage of it does.
So what health problems are linked to vaccinations?
The major links would be anaphylaxis, so having a reaction to an ingredient in there, seizures, about 1 in 3,000 for some of the vaccines can cause seizures, Guillain-Barré syndrome, so that's a neurologic condition and weakness. Let's see what else. Encephalopathy, so inflammation of the brain. So there certainly are a few conditions, again, rare, mostly cited at 1 in 100,000 to 1 in a million. But I think there are just a lot of conditions that we haven't studied. And if you look at the Institute of Medicine reports, which were the big reports that they did in the early 2000s and around 2010, looking at the research around vaccines, the vast majority of conditions like autism, autoimmune conditions, asthma, allergies, they just said we just don't have sufficient evidence. And that was 10, 15 years ago. There hasn't been one since, but the conclusion at that time was we just don't know. That doesn't show that there is a link, but we just don't have enough good research.
That seems to be a theme today here. Since we've been talking.
It's a theme across all of vaccine research for sure.
Unfortunately. So where do you stand on vaccination mandates, like I was talking about before?
I'm not a fan of mandates. I think that you really need to, like most things, have a freedom of choice and have the ability to discuss your opinion as a practitioner, or whether it's the CDC or, again, public health, like make your recommendations. This is what we believe. This is what we think the research shows, and let people decide what's best for them. I think if you're going to have a mandate when it comes to a medical product, it better be very clear what you're mandating it for. It better be extraordinarily severe, and it better be very limited. And I think that certainly during the pandemic, mandates were used far too easily and far too often. And I hope that we learn and we kind of change the rules around mandates to make it a lot more stringent if we're ever going to have a mandate again, that like, okay, there's like an Ebola outbreak and 9 out of 10 people are dying and we just have to do this. Like that to me is like maybe a very specific situation where some sort of mandate could be reasonable. But also in those kind of situations, you don't need a mandate. Like most people are going to do it. So I think when there's a lot of new information, and you can argue the death rate in COVID and lots of things with COVID, but certainly wasn't something that was killing like 9 out of 10 people. So I think there should have been more choice, and people should have been able to decide what was best for them. And some people would have chose to get vaccines, some people wouldn't. But I don't think you need to force people to do it. I think we give them the best information and then let them choose.
Well, the way the vaccines had to be pushed through because of COVID, I think, was a part of the problem, don't you? It's like they weren't really looked at real closely before they started vaccinating with them.
Yeah, I mean, it was a very specific situation, because when you're in the middle of a pandemic, you don't necessarily have the time to wait 10 years or 5 years to get a study. I mean, if you want the products out there, if you want to wait, that's fine. If you want to get the best research, you can do that, but then you might not have the products for another decade, and they're not going to be very useful right now. So I understand the emergency use, but what I have an issue with is forcing anybody to take it. Like I think it's completely reasonable to move things along fast, as long as you say so. Like you just say, like, look, here's what we know, here's what we don't know. Based on the research we have so far, the benefits seem to outweigh the risks. We don't know anything about long-term risks. We can't know this because it hasn't been long-term. We studied it with this many people. Here's what we've seen. Here are the side effects that we know of. That might change. If you want to do it, go for it. If you feel like you're high risk, go for it. If you don't want to take that vaccine right now, then here's your risk from coronavirus. And you have to choose what risk you take. If you go outside, you could get hit by a tree or lightning or a coconut. Like there are risks in life, and you have to weigh that for yourself. And for whatever reason, the governments around the world felt like they needed to mandate this stuff, which I don't think they did. And I think that's a mistake. And it really harmed medicine and harms people's trust in medicine because they were lied to. I mean, it was propaganda to say safe and effective versus risk versus benefits. And people know that that was a lie, and it just doesn't make sense. Like, it doesn't make sense to say something safe when you haven't had it for a long time, and you don't have to know. Like, nobody knows the future. Maybe somebody does, but they didn't predict COVID. I don't know very well.
No, that came out of left field, didn't it?
Yeah.
COVID was certainly an odd situation. Even the disease itself didn't follow any rules, really, did it?
I mean, it was different for sure. It wasn't extraordinarily different than other respiratory viruses, but it certainly was unique. We've had pandemics before, and so this wasn't like extraordinarily unique to other pandemics, but it certainly wasn't a common thing. And each time it's a little different in how it affects people, who it affects, and how serious or deadly it was. But I would say by and large, it did operate the way that generally a virus does operate, where it's, it gets more contagious but less deadly over time. And we have always had coronavirus. Coronavirus is not new. COVID-19 is different, but coronavirus is just a big part of our colds in general. So, I mean, it was like that, just more serious for some people.
So I've heard, when we're getting the hype and hysteria part, I've heard a lot of people say, the drug companies have hidden financial agendas behind vaccinations. What's your take on that?
Well, I think pharma has a hidden, I mean, I wouldn't say it's even hidden. It's an agenda. They want to make money, right? I don't think they need to hide that.
They're open. Yeah.
And I think it's our fault. I honestly think it's our fault for what's going on with health and pharma at the moment. A company's job is to make money, and they're going to do whatever they can to make the most money. That's their CEO's job. The CEO gets fired if they're not making more money this quarter than last quarter. So they're going to do whatever they can to have the most products that make the most money. That's their job. Our job, the CDC's job, the health association's job, are to look at the products and make sure that they're safe, make sure that they're working, make sure that they're doing the things they're supposed to be saying. And I think that pharma has gotten so big that they own everything. They know what they're doing, and they fund the politicians, they fund the medical schools, they fund the research and the journals, and they're not doing that to be kind-hearted. They're doing it because, you scratch my back, I scratch yours. If I fund the entire news, then they're probably less likely to say something bad about my company. Like that's just the way that it is. They know what they're doing, and we've let them do that. And so, yeah, I think that with vaccines, I mean, of course, if you can create a product that gets on the childhood schedule, that every kid is, not fully mandated, but like basically needs to go to school, that's a lot of money. I mean, they're going to make a lot of money over a very long time. They don't really have liability. And so what they are trying to do, it's what I would try to do if I was running a pharmaceutical company, is you try to get a vaccine on the school schedule. I mean, one, you want a product that works, that protects people, but you want it to be on the schedule, so everybody needs to get it, so that millions of kids are getting it every year, and you're making billions of dollars. Like, why? There's nothing not common sense about that. That's what they're doing.
Well, it kind of looks like the Food and Drug Administration, what they're policing is the food and drug companies' bottom line.
Mm-hmm.
And so we don't really have a regulatory body that looks out for the individuals, do we?
We don't. And I mean, it was supposed to be, right? They were supposed to be independent. They're supposed to be policing. It's like a contractor and the city inspector. It's like if the contractor pays a city inspector to, gloss over the errors they made, doing your house. Like, you don't know they're making errors with the electricity or the plumbing or whatever. That's why you need the city inspector. And if they're kind of paying each other and paying each other off, then we don't really know, and your house falls down. And that's what's going on. These people are going back and forth between the FDA or the CDC and these companies, and they're funding each other, and a lot of the funding comes from those places, and so there's not a lot of independence, and there's also just so many products and so many things, and it's been going on for so long that it's just overwhelming, and it's not an easy thing to be like, all right, let's start to get oversight on all these things, and now we have 10,000, 20,000 chemicals. How do we study them all? It's hard. It's really, really very difficult, and so unless we require better research up front, which I think is what we really need to do, and that's, I think, what we're pushing for a little bit now, is just getting better research up front. Like, you have to have those studies before the product comes out. And obviously
yes,
the companies,
please.
the companies don't want to do that, because why would they want to show their product doesn't work? They want the easiest, best studies that they could do that show that their product works, so they can get them on the market. That's obviously what they want, and that's what, again, anybody would want if they want to make money. They don't want to show a problem with their product. Why would they?
Yeah, and that's to the detriment of the public. You know, why are long-term safety studies still so lacking? Is it? Do you think that again they're patting each other's backs and avoiding it?
Well, I just don't think they're required to do it. So why would they? It's much harder to get something on the market if you have to study it for many, many years and you have to follow people for 5 or 10 years. The vast majority of the research is 1 or 2 years. So they definitely do a lot of pre-licensure research. They do. But, there's 6 months, maybe it's a year. It's certainly not 2 years. They're certainly not following people for a long time. We're not following vaccinated versus unvaccinated people if we're talking about vaccines after the fact. And so you just don't have long-term research because no one's ever done it, and they're not required to do it.
And they're not real anxious to do it.
They're not anxious to do it. So we have to make them do it. Like, we have to say, like, look, and I'm not saying that you should need 10 years of research before getting any product on the market. That might not be reasonable, but you might say something like, well, we want 1 or 2 years of research, and then you must continue that research for the next 10 years after, so we can continue to watch individuals and we can see if anything pops up. And yes, we have some sort of we have like the vaccine safety data link, and we have VAERS, the vaccine adverse reporting, but it's not the same as a research study where you have double-blind placebo control, and it's really control and it's just not the same thing. So we just don't have that. Nobody's doing it, and no one's making them do it, and so we don't have the data. And so when you're saying, like, let's say talk about cancer, right? If you get your hepatitis B when you're a newborn, how would you know if you get cancer when you're 10 or 15? If that has anything to do with it, you wouldn't. You're not going to self-report, oh, my kid got thyroid cancer, so it was because of their. How do you know? It probably doesn't have anything to do with it. But
it's time for us to take another station break, so please stay with us. This is Dr. Warsh, and I continue to explore vaccinations and children's health. This is Mission Evolution, www.missionevolution.org. If there are no tests, who can we trust? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Joel Warsh. His website, theshotbook.com. Dr. Warsh, why do most people misunderstand about testing vaccines and trials? We've been talking about it, but it doesn't seem like the public is really well informed about. They say, oh, well, it's not been proven that it's not safe, but it hasn't been proven anything really in a lot of cases.
I don't think people are informed because they don't go look at the research themselves. And why would they? I mean, I wasn't well informed until I did the research for my book. And I'm an integrative doctor who, I'm a pediatrician, but then an integrative doctor who talks about vaccines a lot. So I would think that if there was a doctor that would be somewhat informed, it'd be me. And yet still, you have to really go look at it yourself. And I think that's on purpose. It's convoluted on purpose so that you wouldn't know. But I just think that we are unsure. And one of the big areas of I guess there's just like a lot of discussion where people don't understand is the word placebo. Because there's a lot of argument around the fact that whether vaccines were placebo tested or not. And the reality is they weren't inert placebo tested. So a placebo is supposed to mean an inert substance, so water, saline. And that is what most people think was done for most of these products. They think they were placebo tested, and they think the word placebo means inert. But when it comes to vaccines, the placebos in a lot of the trials were actually other vaccines or other substances that were not inert. So when you say it was placebo tested, it's true, it was placebo tested, but the placebo wasn't inert. So it's not the best kind of safety data.
Well, it's like polluting the results right there.
Exactly. You are. So it's not that it invalidates the research, but it's just not the best research because it's not a baseline of safety. So if you, like, for example, if you studied one vaccine versus another, and in both groups you had 10 seizures, right? You could conclude from that research, well, there's no increased risk from one vaccine to the other because both groups had 10 seizures, so it's safe. But if you did 3 groups and you had one vaccine versus another vaccine versus no vaccine, and you had 10 seizures, and 1 seizure, that's a very different study. And so it's not necessarily nefarious, but it is, I guess, giving yourself the best chance, right? I wouldn't even say misleading. It's just giving yourself the best chance to have the best results, because when you're doing a double-blind trial, unless you're totally lying, there's no way to know what happens. So if you kind of rig the deck before and you're like, all right, well, if I give one vaccine versus another, the side effects are probably going to be similar, so we won't see any side effects. And that is what they have done, and no one ever made them do anything different.
So As a pediatrician and as a functional medicine person, how would you recommend parents approach vaccine decisions?
I think it's really important that you do your research. I think people have to start looking into this. The first step is to start asking questions. Number one, most important thing is the word vaccine has to no longer be censored. We have to not be afraid to talk about it. We have to be okay to ask our doctors questions. And I think for those that are open to having those discussions, if you're going to a practitioner that's not willing to have those discussions, go to one that is. It doesn't mean that you shouldn't do it. It just means that you shouldn't feel bad about asking questions. You shouldn't feel bad about wanting your kid to be the healthiest and the safest, and anything that you're putting into your kid 20, 30, 50 times, you should be okay to ask some questions about it. And I think you want to be with a provider that's just open to having those discussions, because if you do happen to be the kid that has a specific genetics or a specific reaction to a vaccine or whatever it is, you want to know that they're open to going slow or being mindful of your kid, as opposed to just like, no, just do it. It couldn't be because of the vaccine. So I think that's the first step, is just being open to talking about it. And I think the more that we talk about it, then the more we're going to see that paradigm shift. And I've been super excited since this book came out to really see that I haven't got a lot of hate, which I wasn't sure if I would. I wasn't sure people are going to be really mad. I mean, I knew people are going to be mad no matter what you do with vaccines, but people have been pretty nice and pretty friendly and open to talking about it. And that's good. I think that we should be able to have these conversations, and there's no reason why this should be controversial. We're just talking about a product and the pros and the cons.
One of the things I observed, I worked around in doctor's offices and stuff as a practice myself, and show up. Were you able to follow me there? It looks like we had a glitch. The drug companies would show up, and the doctors would run out and spend a little time with the drug rep and come back with some samples. And that was the extent of their education on the drugs coming out, because they flat didn't have the time otherwise. What do you think the ramifications of that are?
We know that the ramifications, I mean, they've studied that a lot, and that's why they stopped having all these reps mostly come out, because you can be influenced for sure. I mean, you're influencing based on external factors what your decision making is. And I mean, I think it's good to have education, but I think if you're starting to get educated in a way where you're like getting, taken on fancy trips and giving all sorts of, different perks, then that can really influence what you might do in practice. So I think we have to get back to just gold standard research, and we need to get back to doing what's best for our patients without the bias. And I don't necessarily have a problem with drug reps per se, but I think it's kind of in the way that things are presented. And I think generally nowadays it's a little better. I mean, other than maybe lunch, they don't really do too much anymore. And even that, they don't do that much anymore. But it is good to get information. It's just hard because you're so busy that it's hard to keep up on every single thing. There's a lot going on in the world to know each and every new medication. But I also think we have to be very mindful that, of course, the company coming to talk to you is going to show you their product in a very rosy way. And we have to be just mindful of that. So I think the more that we can educate practitioners and kind of go back to like, look, we're not taught about why not to trust pharma. No one has that program in med school. And we have to be a little more skeptical, and it has to be okay to be skeptical. There's nothing wrong with that.
And it seems like one of the things going on in the medical system at large is between the insurance companies taking over, and while the doctors were trying to cure people, the insurance companies took over the practices and dictate now. In my opinion, well more than they should dictate. Doctors are restricted as to how much time they have available for their patients. It isn't conducive of putting up with a bunch of questions about vaccinations. How much do you think that this whole system is starting to fail us?
Well, I think the system is failing. I agree with you. It is. I mean, you make a very good point, and I said this many times. Like, it's really hard to have a conversation about vaccines in the new system, right? It's a lot easier to be like, all right, you don't want to get vaccines, go somewhere else, because you need time. Like, you have to talk for an hour just to scratch the surface on things like vaccines, right? I mean, I read a book, and that's going to take you ever how many hours, 10 hours or whatever to read, right? It's like, I can't have, even in my practice where I have a private practice where I have more time, I don't have 10 hours with a patient, right? So you just need more time, and certainly more than 2 or 3 minutes. And the current system just doesn't allow for that. And doctors are really bad at kind of unifying and advocating for patients. I mean, we've just gotten so busy, and I think that, I hope that over the next decade or so, doctors get a little better at this, because really the medical system has taken over, and it's no longer about patients, and it's just about money and businesses. I mean, not the doctors. Like, the doctors care.
No,
I know,
they're killing
but
themselves.
it's like
You
it's
know?
like it's at a point where it's not sustainable anymore. Like, you can't see 40 patients a day. You can't do a good job when you have 3 to 5 minutes. You just can't do it, and the insurance companies don't want to pay you, and they don't pay you very much, and they're decreasing what they're paying you when the costs are going up on everything, and they tell you what to do, and they don't cover things that should obviously be covered. It's just a bad system for everyone all around, and we have to pull our way out of it and get back to, well, what's best for the patient, and that's going to take some system overhaul.
Yeah, I mean, I see the doctors just working themselves to death, and they're hamstrung at every turn. They have to spend so much time when they're part of the time that they don't have with the patient is trying to find a diagnosis code to pacify the insurance company. So it's really gotten out of hand,
Yeah.
you know. So, what would you like to see in public health messaging?
I would like to see more honesty. I would love to see doctors kind of coming together and taking the reins and pulling it away from business and more towards patient health, and really see the messaging focus around prevention. I think that's a big part of, whatever you want to call it, Make America Healthy Again, or whatever the movement has been over the last 6 months to talk about chronic disease. Like, there has been a focus for the last decade, 2 decades, on treatment. I mean, focus on, we need a vaccine for this, we need a pill for that, and again, it's not all bad. Like, there are things that we have can save your life. That's great, but we need to refocus and reprioritize some of our attention on the prevention. Like, when you talk about measles, right? You hear about measles outbreaks here and there, and the media is like all about the vaccine and all about the outbreak, and you don't hear anything about eating healthy, or you don't hear anything about sunlight or anything about exercise. And the same thing during COVID. It was like, get your vaccine, get your vaccine, get your vaccine, and don't go outside, don't be around people. Nothing about healthy eating, nothing about movement. We were doing like the literal opposite things that have to do with our health. That has to change. We cannot focus solely on a vaccine or solely on a medication. We have to give at least equal airtime to prevention and health and wellness, and get ahead of the problems and talk to people about the basic things that they can do to change their life. And then also, we need to have that push in politics to change the system. I mean, we need to change the food, and we have to change the healthcare and all these things. These are big problems, but we have to make changes if we want a healthier future.
And they need to happen pretty fast, don't they?
Yeah, we need changes, and I don't think everything's going to change fast, but we have to start seeing change, and with the new administration, I mean, you like them or you don't like them, but we're certainly seeing change. So I think that part is good, and where things will kind of fall out in the long run, I don't know, but I'm glad that we're at least talking about it and seeing changes, and hopefully that change will be a net positive. I think it will be.
Do you think that some of the changes need to start in medical school? Because
Oh yeah. Oh yeah. No, I think the medical system needs to change. I think that it has to start from education, and there has to be a reprioritization of health, not of disease. Like, when you learn about nutrition, we learn about nutritional deficiencies, right?
Mhm.
That's important. You got to learn about that, but you also need to, we need to have a class going through all of med school, like how to eat healthy, how to live healthy, how to prevent disease. Like, that has to be a part of the discussion, and it needs to be intertwined in, and there also has to be some intertwining of why not to trust pharma. Like, what is going on, what has happened, what is the history, how do we push back, how do we work together, how do we focus on patient care versus what makes the most money for pharmaceutical companies, because they're not our friends. Like, pharma companies, like patient, it seems like doctors and patients are being put against each other, and we're on the same team.
Right.
We're on the
Exactly.
same team, so we need to work together.
So, real quickly, we're just about out of time, but I have to ask you, Dr. Warsh, what's your mission?
My mission is to really help our kids to become healthier than they are right now. I want our kids to grow older than we did and to live a healthier lifestyle than we did. And I don't think we're going that direction. So I want to turn that around. And my very current mission is to discuss vaccines. I want to get the vaccine conversation out there. I want to have debate and discussion that's nuanced. And I want people to say the word and to discuss it and to be open to having those conversations. And I think that we need to get some nuance back and not just be afraid to talk about it with our doctors and have conversations like this. I think the more of this that we do, the better.
Well, thank you for doing what you're doing. It is so needed. But
Thank you.
unfortunately, we are out of time. Dr. Warsh, thank you for coming on the show.
Thank you.
Our guest this hour has been Dr. Joel Warsh, an integrative pediatrician and author of Between a Shot and a Hard Place. To find out more about Dr. Warsh, where you can find his book and all he has to offer, visit his website, theshotbook.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. But please, be sure to join us again right here on the Voice of Canada Broadcast Network, vocbn.ca, where this mission will continue, bringing information, resources, and support to our rapidly evolving world.